Hello, my name is David Wortley. I'm a Vice President of the International Society for Digital Medicine, and it's my pleasure to be talking to you today on this prestigious international conference. Before I start with my presentation, I'd like to just give you a quick guided tour of the virtual TV studio that I'm in now. And you can see I can change different camera angles to focus in on my presentation or give you an idea of the guided tour. So today I'm going to be talking to you about public health technologies and strategies in the fourth industrial revolution. And how I'm going to address this is I'm going to begin by asking the question, what is the fourth industrial revolution? How will it impact medical professionals? And then I'm going to talk about some of the key public health challenges that we face today and the imperative need to shift from cure to prevention. I'm going to be looking at how technology can tackle these challenges and talking a little bit about some of the solutions based around lifestyle medicine and digital therapeutics before moving on to the conclusions. So looking at my slides in detail, the Industrial Revolution, we're now allegedly in the fourth industrial revolution. So I thought I'd just give a quick review of what these industrial revolutions consisted of. The first industrial revolution really was triggered by the use of steam power and mechanization. And it led to a big period of disruption in society, but also great innovations. The second industrial revolution at the turn of the 19th century, 20th century, involved the use of electricity, oil, mass production assembly lines. And again, it was very disruptive, and that some people benefited from it, other people did not. We had an intermediate period where we were affected by two world wars and a depression. And the third industrial revolution started in the 1960s, probably, with the invention of computers and electronics and automation. And now we are entering the fourth industrial revolution, which involves a range of technologies, but the most important technology associated with this is artificial intelligence. But I will stress that it is not the only or the most important technology. Before the fourth industrial revolution, we went through the third industrial revolution, and pretty much there's a kind of seamless overlap between these. And this is where we saw the birth of the computers, the IBM computer, a range of different clone devices, then personal digital assistants. In the early 21st century, we started with Web 2.0 and social media. Now we have smartphones, and now we're moving into an era of artificial intelligence and trying to respond to those. So the point I want to make is that during this third and then fourth industrial revolutions, intelligence and human knowledge has been increasingly embedded within technology. And what we've seen is a massive increase in the amount of digital data that's stored globally. In the 1970s, looking at data storage in terms of terabytes, it was virtually negligible. So in this period of just over 50 years, we have seen an absolutely massive increase in the amount of digital data stored globally. And in fact, my home computer, the one that I'm talking to you now, stores more digital data than actually existed in the whole world in the 1970s. And what these technologies have done has led to the rise of what I call the prosumer, the technology-empowered citizen. So people are now no longer simply consumers of technologies. They can use technology to be creative producers. And all of this started with personal computers, accelerated during the internet age, the 1990s, with Google and Web 2.0 and smartphones, increasing empowerment there. And today, with the Internet of Things, cloud computing, artificial intelligence, etc., what we've seen is technology leading to personalization, democratization, and consumerization of digital technologies. And if we look back to the first industrial revolution, one of the biggest societal impacts of the first industrial revolution was a rebellion against the technology which was seen as replacing human skills and livelihoods acquired over a lifetime. And it was led by a weaver called Ned Ludd in the UK, and it led to people destroying the technology they thought was threatening their lives. In other words, the weaving looms and the mechanisation of weaving looms. And it took severe action from the government and the military to quell the people who were most affected by the first industrial revolution. So today we are all users of technology. It's been so much consumerized, and what I identify today is a phenomenon that I call etidals and Luddetidals. Luddites are going back to the days of Ned Ludd. They are described as people who are opposed or worried about the impact of technology on jobs, livelihoods, humanity, the economy, environment and society. And that probably sounds familiar. But an etidal, and it is what basically us again, we are consumers who are demanding better, faster and more accessible technologies to make existing jobs less demanding, to create new jobs, to boost the economy and improve the quality of life for everyone. So in the middle there are what I call Luddetidals, people who bridge this. We're concerned about the technology, but we still continue to demand these improvements. So how do these challenges affect the medical professions? So, well, there are going to be winners and losers in the fourth industrial revolution, and here are some of the professions and trades that are likely to be winners and losers. And we ask ourselves the question, what does the future hold for knowledge professionals and lifelong careers when artificial intelligence is becoming increasingly capable of doing jobs which previously are done by human beings? Whereas the traditional trades, ironically, painters, decorators, plasterers, plumbers, electricians, etc., artificial intelligence and robotics still are unable to compete with human skills. So it's likely that the trades are going to be winners in this, and the ones who are described as knowledge professionals, that includes a lot of people in the medical profession, are likely to come out worse off. So looking at the impact of the fourth industrial revolution on medical education, for example, how do you teach radiologists when diagnosis will be done by artificial intelligence? What's going to happen to radiologists who are very skilled people who base their learning and their experience on being able to analyse scans from MRI scanners and X-rays and make the diagnostics? Today we're at a stage where artificial intelligence is better at doing this than human beings. So how do you prepare radiologists for the change in the nature of their jobs? Also, on a more positive hand, it's enabled and empowered a lot of junior medical professionals to take on more responsibilities through the assistive use of artificial intelligence. So it's changed clinical roles, responsibilities and practices, and allowed people like nurses to take on higher level tasks. And here's an example of how technology is disrupting surgery. On the left-hand side, you'll see a traditional old-style operating theatre. On the right-hand side, you'll see a modern operating theatre with a robotic surgeon. And in the middle, you'll see a picture of a lady performing removal of a gallstone using laparoscopic tools in a simulation which is designed to train surgeons. The point I want to make about this is the lady who is performing this simulated operation is my partner. She has no medical training, she does not play computer games, and yet, using the tools and the technology, she was able to get better results through this simulation than a lot of trainee surgeons. So it begs the question, how is this going to affect the people we recruit and how we train them? What kind of skills are needed to be a surgeon, and how long do we need to train people when we have these kinds of tools that are available? So coronavirus has made some enormous changes. It's accelerated the digital revolution and had a very major impact. Because of the restrictions on physical contact, it's led to a greater demand in teleconsultations and webinars assisted by technology. It's led to a bigger demand for telemedicine and remote care. It's increased the use of consumer wearable technologies to monitor patients, and I use these wearable technologies that I'm going to talk about later. And it's brought about an era of personalised healthcare, so it's no longer one size fits all, supported by artificial intelligence and technology like epigenetics, meaning a big shift from cure to prevention in order to survive and protect our public health services from the unsustainability that they're facing at the moment, and integrated care services. So remote patient care, this is indicated by the technologies available now, making it possible for people to be looked after at home rather than in a hospital ward, and there's some significant benefits to the productivity of general practitioners and nurses, and it's likely that future care will shift towards homes and communities away from hospitals. But it's important these technologies are supported by humanity, and the application of technology without humanity is going to be a disaster. So human characteristics like empathy will be extremely important in leveraging the power of the fourth industrial revolution. So the global health challenges, I am sure you are all familiar with, but I want to touch on probably the most important, because most people today are dying from non-communicable diseases. Even with the pandemic and coronavirus, the biggest cause of death are non-communicable diseases, and a lot of these morbidity is related to our lifestyles, and it means a major increase in public health costs to be able to treat obesity, diabetes, cardiovascular problems, cancers, all of which are related to the lifestyles that we currently lead. So as an example of this is my late partner's, it's my partner's late father lived with us for a period of 12 months, and we saw at first hand the challenges of comorbidity and the fact that the response of the medical practitioners to treating some of the many problems that people in their later life can have is to provide him with a massive portfolio of drugs, which my partner used to have to administer for him. So on the right hand side you'll see what his daily drug regime was when he came to live with us in the beginning. And on the right hand side, you'll see his end of life daily drug routine, which is a lot less. So, how are we going to be able to keep public health services sustainable in this kind of environment? Well, it really involves a transition from cure to prevention and involves behavioural change in our lifestyles. And the best chance, according to Sir Simon Stevens, who was the head of the NHF in the UK, our best chance of doing that, and increasing our lifespans and improving our overall health, is to adjust our personal behaviours and develop good habits, and to do so at an early age. But this is not trivial. How can we influence lifestyle behaviours in the kind of world we live in today? How can we influence these behaviours and circumstances, not only at an individual level, but also at scale? Well, there is a practice called lifestyle medicine, and this practice of lifestyle medicine focuses on key health and well-being influence: diet, exercise, hydration, sleep, mindfulness and stress management, social support, and also avoidance of toxic substances, including drugs and pharmaceutical interventions. But how can technology solve this problem, which is what we're looking at today in the fourth industrial revolution? Well, I believe that consumer digital technologies like wearable devices are going to play an increasingly important role, because these technologies are becoming more and more medical grade. They measure the key influences on our lifestyle behaviour. They allow us to create personal benchmarks, set achievable goals. They can help to provide a supporting environment, and a range of digital therapies available to help people to manage their personal health better and encourage personal responsibility. So this is, in my opinion, where the future lies. I've been a practitioner of lifestyle medicine and wearable technologies for 10 years, so I've seen at first hand the benefits that can accrue from this. So the enabling technologies involved in all this are wearable devices, smartwatches, etc. The mobile applications on our smartphones. Artificial intelligence will play an increasingly important role in ensuring the accuracy of interpreting the data that these devices provide. But AI can't work on its own. It needs to have a portfolio or a cocktail of enabling technologies, wireless technologies, cloud computing, and immersive technologies that are designed to engage and influence people. And also the process, I believe, of gamification to encourage people to adopt this. So these are the kinds of dashboards that I've used over the last 10 years that allow me to monitor and manage my physical activity, my diet, my sleep, and a whole range of other things that empower me. Wearables and mobile applications are leading to the point where not only will patients be able to come to their doctor equipped with all of the data, or most of the data the doctor will need to make a diagnosis, but in many cases they may well be able to show the doctor what is wrong with them. And this is increasingly a phenomenon. So digital medicine and digital therapeutics are going to play an increasingly important role, because these can influence our behaviours and help us to make informed health solutions. And the technologies involved in digital therapy provide alternatives to drugs and the comorbidity challenges I referred to earlier. There are also lots of rehabilitation apps which allow people to recover from strokes, manage Parkinson's disease, a lot of other not only physical but cognitive problems in their own home, rather than having to visit a specialist clinic. And in my own case, I use these technologies to look after my own personal health and well-being. And I made this this little video to give some sort of very quick guidelines to the role of these technologies.
Health. Everyone is the same. Health and well-being is influenced by what makes us human. We all have emotions like hope, fear, love, ambition, and jealousy, all of which influence health. In health, we're all different. Health and well-being is influenced by individual situations. We have different ages, genders, DNA profiles, cultures, and socio-economic circumstances. Routines can be good for health. They can provide stability, certainty, and lead to good practices. But routines can be bad for health. We can develop bad habits and become boring and predictable. Spontaneity can be good for health, leading to personal development, motivation, and new routines. Spontaneity can be bad for our health. Uncertainty can lead to fear of the future and bad habits.
So that's an example of a digital human, and I'm going to touch on digital humans in a few minutes, but digital therapeutics and artificial intelligence are likely to be very much enhanced by biometrics. That's the use of devices that measure our physical condition. In the case of the picture on the screen there, I have a device which is on my forehead, which is measuring my brain waves. So it's telling me my mental state, how I'm concentrating, whether I'm relaxed and whether I'm stressed, etc. And it goes even further today that tools are being provided that allow you to explore these technologies and develop skills that allow you to control your sense of focus and your relaxation and your stress management. I'll just play a little bit of this video that gives an indication of how this works.
The headband on, and signals from the headband go to the MindPlay hub, and what I'm going to try and do is switch this fountain on and off through the level of relaxation that I've got. So I need to make sure that the mind band is securely fastened to my head.
So I'm doing this exercise, and what I'm trying to do is to use my brain waves and relax. And by relaxing properly, I can control an electronic device which will switch a fountain on. So you can see the fountain lighting up there and the water flowing through the fountain. So I was successful in being able to relax, and my level of relaxation is shown on the device there. But then I go on to throwing a switch which will test my level of focus and concentration. And again, now I'm trying to focus and turn the fountain on. And you can see that I am successful.
My focus is 100%. The fountain is on. I can try and distract myself by looking elsewhere, and the focus goes and it drops and the fountain switches off. If I go and concentrate.
So that's a modern example of digital therapy. Looking briefly at digital humans, we now have consumer software available on the web and also on smartphones, capable of generating digital humans, very lifelike digital humans, according to our specification. And these digital humans are extremely realistic, and it's possible to use one of these AI-generated digital humans with conversational capabilities. And this could transform both medical education and clinical practice. So you can imagine if patients want to have a consultation, they maybe no need to talk to the doctor. They can talk to a digital human, looks extremely lifelike, and providing advice which not only accesses their medical records but also validated medical knowledge bases. So the doctor's role is going to shift, I think, from cure to prevention. And in conclusion, I would say that the fourth industrial revolution is going to present major challenges, but it also will create great opportunities. And lifestyle medicine, I think, is going to be key to preventative healthcare. And the digital technologies, which measure our key health influences, because they're increasingly affordable and increasingly medical grade, they have the potential to have a big impact on public health policies and strategies. So behaviour change, though, is complex and it depends on your personality and socio-economic circumstances. But the point about this is the fourth industrial revolution enables digital ecosystems that can facilitate win-win collaboration between health stakeholders. Thank you very much for taking the time to listen to me today, and I'd be very happy to answer any questions that you may have. Thank you.